The supplement called NAC is also known by its full name, N-acetylcysteine. NAC has been touted to be beneficial for just about everything, and many people call it the ideal supplement for heart, lung, and liver disorders, but is it really? In this video, I'll use the data from currently available human clinical trials to explain when it is likely to be beneficial versus when it is likely to be of little or no benefit, as well as the dose and other important information that you'll need in order to decide whether you should be taking NAC. With respect to NAC actions, the primary role of NAC in our body is associated with its antioxidant and anti-inflammatory activity. NAC has both direct antioxidant activities and indirect actions with the ability to increase levels of one of our most important antioxidants, glutathione. It also has actions of being able to break up disulfide bonds, which are contained in mucus, so it has mucolytic actions. And finally, NAC has anti-inflammatory actions, being able to suppress some of the most important mediators of inflammation. There is a long list of conditions that have been successfully treated with NAC, and those include lung disorders. NAC can be beneficial in any condition in which the person can benefit from breaking up mucus, for instance, asthma and chronic bronchitis. But NAC also decreases inflammation in the lungs, so it's not surprising that clinical trials have found that taking NAC for 6 months decreases flare-ups due to moderate to severe chronic obstructive pulmonary disease. NAC has also been found to be very valuable in liver disorders. NAC is valuable in acute liver toxicity, for instance with paracetamol or acetaminophen toxicity, because it binds to the toxic components. Supplementation also appears to delay the time before transplantation is necessary in chronic liver disease. NAC supplementation is also beneficial in cardiovascular diseases for a number of reasons. NAC decreases angina, helps maintain heart function, and reduces heart damage in people having a heart attack. It also helps prevent heart attacks and strokes in people with kidney disease and reduces homocysteine levels, which is a risk factor for heart disease. And finally, it decreases cholesterol and blood fat. With respect to other benefits of NAC, supplementation also decreases flu symptoms and decreases irritability in children with autism. But other than that, there is no good scientific evidence to prove that NAC supplementation will be good for other disorders, although of course future clinical trials may prove that they are. If you do decide NAC supplementation may be good for you, make sure that you check with your healthcare practitioner before beginning the supplementation. The dose used in most of the clinical trials was 600 milligrams per day, although some of the trials used 600 milligrams every 12 hours. NAC has been associated with minimal side effects. In oral supplementation, the most common adverse effects are the GIT symptoms such as nausea and vomiting. And that is oftentimes due to the fact that NAC smells a bit like rotting eggs because of the fact that there's some sulfur content in that supplement. So you may want to actually try to get the encapsulated version rather than the powder. If you do decide to supplement with NAC, I'd really like to know why you started and also what you experienced in the first 23 days. So please post that in the comment section below. Thanks for joining in, and I'll see you in the next video.